All right, like I said, we're moving item number 18 to right now. Excuse me one second. The consideration of an ordinance banning the sale of flavored tobacco and flavored vaping products in Yuba City is presented by Mr. Vice Mayor.
Thank you, Mr. Mayor.
You're welcome.
Excuse me. For the sake of the discussion and to get things started, this is the beginning of a process. I think some may be thinking that we're considering for approval a final ordinance tonight. That's not what this is about this evening. This evening is about a discussion amongst typically the five of us, but also with input from the public in regards to we want to continue to move forward with an ordinance that might have in it certain restrictions on flavored tobacco or vaping. With that being said, it's certainly my intent, and I believe I can speak on behalf of the rest of the council, that this process be open and transparent and include all those who are affected. This originates from presentations that we've had in these chambers from the Sutter County Health Department on tobacco, flavored tobacco, and the impact it has on children within our community. At least my purpose in bringing it forward is for us as a council to have the discussion and decide whether or not we want to do something with it. I know on my left, we have Councilwoman Espandola. She's been involved in this, with these projects for quite some time. And I know that at some point we'll be asking you to share that with us. But with that, Mr. Mayor, I'd just like to open it up. I know there's a lot of folks in here this evening that would like to speak, and I'd rather hear from them first than have them listen to me.
All right, very good. I do have several speaker cards, but please keep in mind if you wish to speak on the item and have not filled out a card, the card is not required. It just kind of helps me move things along. And then the only order I put these in is what I always do, and that's alphabetically. So we're going to go with Miss Tammy Anderson first. Miss Anderson, or those of you who do come to the podium, if you would mind, please stating your name and I believe your city of residence, if you don't mind.
My name is Tammy Anderson, and I just moved to Live Oak from Yuba City. And I'm here today, and thank you for allowing us to speak and for moving it earlier. We appreciate that. I'm from the Public Health Department, and as the project director for Sutter County Tobacco Control Program, I'm here tonight to talk about Sutter County youth tobacco use. We were lucky enough to contract with the University of California, San Diego, to get local data from the California Youth Tobacco Survey. Normally they choose one school and then they use it in the state data, and then they lump us together as regional data with many other counties. And so this is the first time that we've gotten clear data on what our youth are doing in regards to tobacco use and vaping. So I thought I would share that information with you here today since you haven't heard it yet. So of course we know that tobacco use is the #1 cause of preventable death in California, and it continues to be an urgent public health issue. The U.S. Surgeon General has declared an e-cigarette epidemic among youth, with national data showing skyrocketing youth use of these products. Some of the information that we've collected from the tobacco survey, we collected it from over 2,000 youth in 11 Sutter County schools. And the survey found that among Sutter County students, 30% of them have tried a tobacco product. Nearly 20% had been offered a tobacco product within the 30 days of them taking the survey. But the most alarming statistic that we found is that over 1/3 of Sutter County students who had never used a tobacco product before are susceptible to future use of tobacco products. So they are able to ask certain questions that will lead them to believe that the children will use it in the future. The question actually asks if their best friend were to ask them to use a tobacco product, would they? And they indicated that they would. So that's 1/3 of our students who've never used tobacco. The research also shows that over 43% of students in Sutter County believe that it would be easy to obtain e-cigarettes. In Sutter County, 78% of our youth shop in convenience stores, and 80% of these youth report seeing flavored tobacco ads or promotions. In 2016, we did the Healthy Stores for Healthy Communities campaign and found that in Sutter County, 100% of tobacco retailers near schools sell flavored tobacco products. The youth in our community are also 8 times more likely to see advertising for unhealthy products like tobacco and alcohol than they are for healthy products like fruit and water. Youth are also 3 times more likely to be influenced by tobacco advertising than adults are. So you have to remember that their brains aren't fully developed yet, and so they're more susceptible to what they see in our community, which means that what they see in our community can influence their behavior and their choices. 84% of Sutter County youth who currently use tobacco use a flavored tobacco product. With declining cigarette use rates, the tobacco industry is looking for a new generation of addicts. Predatory marketing directly targets youth, making these products look appealing, youth-friendly, cheap, and socially acceptable. Ads appear all over social media and often emit dangerous health effects and the extremely addictive nature of these products. The recommended strategies to address the youth vaping epidemic as well as curb traditional tobacco use are 1, a flavored tobacco sales restriction that includes e-cigarettes and menthol cigarettes, which would make tobacco less appealing and less accessible to our youth.
Tammy,
2 is adopting.
Tammy, we have 18 people and we have a time limit. That beeper is telling me to tell you to wrap it up.
Fine.
Your point has been made, though, but go ahead.
Adopting a tobacco retailer licensing law. And thank you so much for having us.
Thank you very much. We really appreciate it. Let's see here. We'll go on to Jasmine Chow. Is it Jasmine, right? Jasmine, okay. Sorry about that.
Hi, my name is Jasmine Chow. I'm a manager at NetVapes here at Yuba City. I'm from Marysville. I'd like to read a statement for Jeremy Howard, one of the owners of NetVapes, as he's currently out of state and couldn't be here tonight. Vapor products were classified as a tobacco product many years ago by the state. With that came tobacco taxes and regulations. It's already one of the most regulated products on the market with a 59% tax rate. The products we manufacture are 100% up to date on all FDA deeming regulations. California in 2016 raised the age to purchase these products to 21. It is already illegal to sell these products to minors, though no penalties exist for minors in possession. Our stores are adult-only 21 and over establishments. Minors are not allowed to walk through the doors. Similar ordinances that have passed across California do nothing to stop online sales of these products. On the preliminary data on other states that have passed similar statewide bans bans are not having the impact they hoped. Face-to-face transactions where a physical ID is checked remains the strongest barrier to youth access. What a flavor ban would do is remove adults' personal freedom and choice to use a flavor that has helped them quit smoking. And adults have quit and are quitting smoking using these products, so specifically flavored nicotine products. It could also give rise to a black market of these products, much like we've seen with the recent illnesses associated with black market THC vapes. 91% of our e-liquid sales are non-tobacco flavors, all purchased by adults. You can imagine the impact such as an ordinance would have on our business. Our 12 employees and our thousands of customers that utilize a less harmful alternative to cigarettes and vaping is a harm reduction. As stated in Jeremy's email that he sent to you guys past weekend, the CDC recently released its results from its annual youth tobacco survey. Their data shows that flavors were not the #1 or not even the #2 reason teens have tried e-cigarettes. If flavors were driving the factor to youth usage, why do we tolerate the same flavors in alcohol and recreational and medicinal marijuana? Education is always one of the best remedies. I've heard from many parents and teachers that they cannot tell the difference between a nicotine vape and marijuana vape. We are more than willing to assist the city in matters if ever called upon. Thank you for your time.
All right, thank you very much. Next we have, and forgive me if I mispronounce it, is it Maynard Sagar?
Good evening. My name is Minh Au, and I'm the Secretary of Student Advocates for Sutter County, a youth coalition and club at River Valley High School. At our school, vaping has become a serious issue with more youth becoming addicted to nicotine every day. A 2016 study found that young people vape because the products are flavored, and they believe e-cigarettes are less harmful than cigarettes. Last year, at an educational event presented by the student advocates for Sutter County at River Valley High School, various toxins found in e-cigarettes and vapes were displayed. Most students at the event, including those who are current e-cigarette users, were surprised and alarmed by what they have learned. They had wrongly believed that the products that they were vaping were using were harmless. One student was particularly upset by the misinformation and flung his arms and walked away muttering, "Well, I'm screwed." Thank you.
All right. Brian Cowen. Welcome, Brian. Thank you, ma'am.
Thank you so much for having me, Mayor Harris and council members. My name is Brian Cowen. I am currently a Sacramento resident and working with Sutter County Public Health. There we go, found it. So I want to step back a little bit as a public health worker to discuss not only the future of the youth that might go down the road of tobacco use, stress and disease and death, but also how we got to this position because, as we all know, the adults in the room were once youth. So in public health, we see tobacco use not as a moral issue, but as a social justice issue. No person, regardless of age, race, or ethnicity, should be exposed again and again to experiences that we know are harmful. Yet tobacco companies channel more advertising, discounts, and displays of their dangerous products and the health problems that come with them into Black communities, more than white neighborhoods, and more than other communities as well. Sutter County LGBTQ youth were over 2 times more likely to use tobacco than other youth. Young people who identify as LGBTQ report high levels of stress from discrimination or social exclusion, and stress can make people more likely to use tobacco. The stress of discrimination helps to explain why, when compared to straight peers, twice as many LGBTQ youth have smoked a cigarette before the age of 13. To live up to the ideals of fairness, we must recognize these facts and ask for change. During the past decade, the tobacco industry has aggressively increased advertising and promotional campaigns placed in ethnic neighborhoods and deliberately targeted minority youth. Predatory marketing of African Americans, Hispanic, Latinos, and many other priority populations across the decades have resulted in disproportionately high use of menthol in communities of color. In California, 70% of African Americans, 42% of American Indians, 33% of Hispanic, Latino, and 30% of Asian adult cigarette smokers smoke menthol cigarettes compared to only 18% of white adult smokers. What is even more insidious is that tobacco companies have historically sponsored local family-friendly events like rodeos, festivals, racing, and cultural events to give the impression that they care about the fill-in-the-blank community. Though it was banned in 1998, they are now back in with vaping devices. There are other common marketing tactics that continue today. Communities that are predominantly low income are highly profitable in the eyes of big tobacco, so they target them in hard-hitting ways. Not only do these neighborhoods have highest density of stores selling tobacco products, but in these communities, the tobacco industry also offers the lowest prices on packs of cigarettes and products such as little flavored cigars and cigarillos, which can cost less than $1.
You guessed right. That's the red light.
That's it. All right. Thank you very much for your time. I do want to hand a list of 50 communities in California that have tobacco passed flavored tobacco restriction and also a model policy. Oh, one more.
All right. Thank you very much.
Thank you for your time.
Thank you. Move forward to, Samantha Garnish?
All right, hello everyone. My name is Samantha Garnish and I live here in Yuba City, and I am the Vice President of the Student Advocates for Sutter County, a youth coalition and a club at River Valley High School. I have seen the new vaping devices. They are sleek, appealing, and electronic. Our generation has been born and raised in an electronic age, so just seeing these devices have become a normal and natural thing. The tobacco industry tries to trick us into believing that their products are harmless with their flavors and electronic devices as if they know what they're doing. Tobacco is known to cause illness and death, but when you see it being sold on a shelf in a store near schools, you wonder, if it's really that bad, why are they allowed to sell it? Recently, my friend was found smoking in the bathroom. From all the constant tobacco use she was doing, she became skinny and weak. Through the Student Advocates of Sutter County, we try to educate about the harms of tobacco and vaping to our peers, but we are small in numbers and we can't do it alone. We need the support of the community. All right. Thank you, everyone.
Thank you, Samantha. Julie Howard, you're up.
Hi there. My name is Julie Howard. I am a respiratory therapist and case manager. I've been a registered respiratory therapist for over 35 years with a focus on the needs, medical needs and education for the needs of COPD patients through providing pulmonary rehab, cardiac rehab, smoking cessation counseling in the last 4 years as a COPD case manager. I previously worked at Feather River Hospital in Paradise for about 15 years and started a program here. After the campfire, I came here and started working at Adventist Health Right Out. I have worked with over 1,500 pulmonary patients, most of them with COPD. Approximately 85% of these patients were current or ex-smokers. And I cannot tell you the countless number of stories that patients have told me wishing they had quit smoking, wishing they had never smoked before. So I work on the other end of the spectrum, but I think if we start when they're young and vulnerable, we really need to, sorry, I'm really nervous. We really need to look at banning vaping and flavored tobacco products before they even start. Fewer youth. Flavored tobacco is a key way that tobacco companies get youth to start smoking. 80% of teen smokers started out with a flavored tobacco product. The tobacco industry will be less able to entice youth with its deadly products. Tobacco leads to a lifetime of addiction and increased risk for many diseases. I could name a few, but I think you know them. Coronary artery disease, strokes. I mean, there are so many different products that are in tobacco. It's mind-boggling that it's still legal. Fewer people will die from tobacco. Tobacco is still the #1 preventable cause of death in the United States. COPD used to be, and chronic respiratory issues used to be the #4 killer in the United States. It's now #3. Obviously, heart disease and stroke are #1 and #2. So I urge you the City Council to seriously consider moving forward with banning tobacco and flavored tobacco products, especially targeting our youth. Thank you.
Thank you, ma'am. Karen, you're up.
My name's Karen Leggett, and I'm a Marysville resident. And I used to be an advocate at the Capitol for 4 years for children against pot, tobacco, everything that's going to destroy our children. I'm on quite a few organizations to stop the pot and the vaping and the CBDs, all of it, to protect children because I have so many stories that are killing our youth. And so that one thing I wanted to tell you, I go to San Brandon Park in Yuba City often. There is a bunch of street people that sit there all day long waiting on the youth to show up. And when I see the youth, I tell them, go the other way, because these people are trying to ruin your life. And sometimes I have called the police on them because they get aggressive. They start following the kids. And then I step in and I tell them, back off, because I'm not going to go ahead and let people ruin kids' lives. And in Marysville, when the pot dispensary opened up by the hospital, I witnessed 3 teenage kids on the corner. An adult guy came from the pot dispensary to the corner, and I assume he gave them some drugs, the pot. And then I called the police, and evidently the guy took off before the police could get there. And my thing for 40 years now is to protect children. Please consider banning it in Yuba City, because there's so many kids that are ruining their lives. They're dying at the profits of these people. They don't care. They do not care. And all they care is that money that they're going to get. They don't care about the kids' lives. Please protect our youth.
All right, thank you very much, Karen. Dr. Fong Lou. There she is.
Good evening. My name is Dr. Fong Lou. I'm the new Bi-County Public Health Officer. I'm here to voice my support for the consideration of an ordinance banning the sale of flavored tobacco and vaping products. I just want to really reiterate what a lot of the speakers have said, that these flavored tobacco products and vaping products are really like the gateway entry for a lot of the youth. And your mind doesn't fully develop until age 25. So even if you try it and then you are exposed, it's very, very hard to quit. And I've tried with all my patients. I'm a primary care physician also, and most of my patients struggle 5th time, 8th time to quit. And they don't succeed because they started very, very young, age 12, age 16. In addition, is that most of the youth do not realize that these flavored products are actually tobacco. They think that just because it's flavored, they link it to like candy. And it's very troubling in that regard. Thank you.
Thank you very much, Doctor. Claudia Medina, welcome.
Hello, everyone. I'm Claudia Medina, resident of Yuba City. So I'm going to talk about just some of the health effects of nicotine and menthol and mint. So nicotine is one of the most toxic of all poisons. It can rewrite the brain, especially those particularly vulnerable in the developing years from adolescent to mid-20s. Especially nicotine's negative effects on the young developing brain, which finish maturing by the age of 25. And it's associated with the prefrontal cortex ability for judgment, attention, and behavior, contributing to mental health issues. Due to nicotine's impact on the brain receptors, it can alter the brain's development and lead to impaired cognitive functioning later in life by affecting a teen's attention, learning, and memory. It can worsen stressors already challenging in adolescents, like learning difficulties, irritability, anxiety. Furthermore, the aerosol that is produced by these products, such as vape pens, pods, and mods, contain ultrafine particles, heavy metals such as nickel, tin, and lead, cancer-causing chemicals, and flavorings such as diacetyl and other untested for inhalation. However, it's often flavors like menthol and mint that are particularly treacherous. The tobacco industry creates these flavors to make cigarettes more appealing and is seen as a starter product for youth. Among California's high school students who smoke cigarettes, 44% use menthol cigarettes. Younger users tend to perceive menthol as safer. All it really is an additive to make tobacco easier to start and harder to quit. Menthol creates a cooling effect, reducing the harshness of smoke and suppressing cough. Although the FDA banned all flavors in cigarettes in 2009 to protect youth, they excluded menthol from this ban. If menthol cigarettes ban had been enacted in 2011, it could have saved 320,000 lives. The issue here is that menthol products are disproportionately used by smokers who are young, female, and part of a sexual minority or part of a racial or ethnic minority. Over half of the students who smoke and vape use mint and menthol flavored products. Menthol facilitates an addiction disease and creates health equity issues for our community. Thank you for your time.
Thank you, ma'am. Erica Melcher.
Hi, good evening. I'm Erica Melcher, and I live in Yuba City. It's okay, it happens all the time. I live in the community. I am a parent. I have 3 children. One is a high schooler. So I often hear a lot about vaping and what's happening on campuses. But also, formerly, I worked with Sutter County Schools in providing tobacco prevention. So I'm really familiar with the topic of vaping and flavored tobacco, and so it is out there. Our youth are using it. The access is very easily for them to obtain. And as a parent, I want to, my goal is to prevent youth access and obtaining those products, prevent that they even initiate using these products. It's important, I think, as a parent living in a community where you do have support from other family members, friends, the schools, other organizations, that you feel supported in that. In addition, working with the schools, I have heard other youth say that, oh, it helped my parent quit with using regular cigarettes. However, there has not been an approved e-cigarette approved by the FDA that it is essentially a product. In addition, the concentrated nicotine liquid is poisonous, and 1 teaspoon is lethal to an infant. And that's just information that, we are working with the schools and working with the Tobacco Coalition in our community. We're aware of that information. Lastly, I'd like to say that I think it's wonderful that so many people have come together, and this is something that you're looking at. So I definitely strongly encourage you to look at this further. Thank you for your time. I appreciate it.
Thank you, ma'am. Katie Moose. And if Cynthia can queue up after for time.
Hello, my name is Katie Moose, and I'm actually a resident of Fair Oaks, but I work for a tobacco prevention project called STAND, and we're working with several rural communities in North Valley and Gold Country on tobacco prevention efforts, including Oroville City, which I'm really excited and happy to tell you that they just voted like 5 minutes ago to ban the sale of flavored tobacco products. And I know a lot of rural communities are considering this. I started smoking when I was 14. And I look back now that I happen to now work in tobacco control, who would have thought, and, thinking about why did I start in the first place. And something I know now that I didn't know then is when I was in high school in the 90s, 30% of high schoolers in California were smoking cigarettes at that time. So, I was smoking with a lot of other people who were smoking around with me. And that rate has dropped in California. I mean, we're looking at like 2 to 5% high schoolers are smoking cigarettes these days, which is an incredible, amazing achievement. And, I think a lot of it has to do with the changing of social norms. I mean, I don't have to worry about my daughter ever smoking. She never really sees anybody doing it. And a lot of those social norm changes happen because of policy changes. And, you might hear some retailers, and it could be true, they're going to say, we don't sell to youth. And maybe that's true, but I do know that the Sutter County Sheriff's Office has been conducting shoulder tap stings over the past year. They've done a bunch of them. So I would ask you to have them come out and share their findings with you at some point. But what they've said is that they're almost always successful, like almost 100% of the time. They're getting people to purchase alcohol and tobacco for underage youth. So even if the stores aren't selling to youth, they're still getting it from the stores. So thank you very much for considering looking at this topic.
Thank you, ma'am. Cynthia. Man Reed is next.
My name is Cynthia Patrick, and I live in Yuba City. I'm also the Outreach Program Manager at Ampla Health, and I'm here today as the chair for the Sutter Healthy and Safe Neighborhoods Coalition. The coalition includes representatives from community-based organizations, local health care agencies, schools, individuals in our communities that have a special interest in healthy communities. We work to create healthy and safe community by reducing risk factors and increasing protective factors. The tobacco industry is targeting a new generation of kids with flavored tobacco products, as you've heard tonight, through low prices, easy access, and new electronic devices. And this is why the Healthy and Safe Neighborhoods Coalition's current priority is to reduce youth tobacco use and access through community education, advocacy, and policy. My 22-year-old son is currently using the Juul. Because this was presented as safe initially, I am challenged with counteracting the information that he received from the industry. It is so disheartening as a parent to watch your son use something that's so blatantly toxic that can seriously potentially harm him. And I know I am not the only parent that is experiencing this. So today, we actually have some letters of support from organizations that support this conversation that we're having, and we also have signature pages from individuals in the community that support protecting our kids from tobacco and nicotine addiction. Thank you.
Thank you very much, ma'am. And last, at least as far as speaker cards go, is Maynard Sagar.
Hi, my name is Maynard Sagar, and I'm the president of the Student Advocates for Sutter County, a youth coalition and a club at River Valley High School. There has been an increase in kids vaping. It has gotten so out of control that our school has to lock certain bathrooms. During instruction time, only one bathroom is unlocked for kids to use. It is inconvenient and can take away from learning when the only bathroom is far from your classroom. In my school year, I once saw a fellow student vaping in class and no one had noticed. Because e-cigarettes come in small devices and do not smell like traditional cigarettes, kids are able to hide them and vape in class behind the teacher's back. Because I see it so often, it sometimes feels like everyone is vaping and kids think it is only okay and won't hurt them. As teens, we urge you to help teachers and parents who are doing their best to protect us from nicotine addiction by banning flavored tobacco, including e-cigarettes and methylated cigarettes. Thank you.
All right, thank you, ma'am. Like I said, that's all of the speaker cards on this item, but if anyone else would care to say anything, we'd be happy to hear your opinion or your thoughts on the issue. All right, with that being said, we'll bring it back to Mr. Vice Mayor.
Thank you, Mr. Mayor. Thank you for those who chose to engage in the public comment. I guarantee that as this process moves on, there'll be other opportunities to speak. What I'd like to do, if it's okay, Mr. Mayor, is pass this over to Councilwoman Espandola for a few words.
Yep.
Thank you, Vice Mayor. Having worked in tobacco initiatives prior to becoming a city council member, I'm really familiar with the topic of this issue of health risk. It does become a health risk issue. It's an environmental issue that is created in communities. I do applaud all the work that has been done through the health department and the schools and these young people for coming in and sharing their perspectives. And I also recognize that local businesses have something to sell for adults. The thing that I've seen conflicting over the years with tobacco initiative issues is how do you manage and control use by minors compared to adults that have the legal right to make their own decisions. And so the Tobacco Control Act allows for prevention and environmental issues of monies to be used in communities to minimize some of the hazards of environmental issues in the area. So they're here talking about, retailers, ordinances, things that could be set up in a community aspect. The work that I was involved with within the schools and doing more of the tobacco issues and prevention. When I originally started the work, I recognized that young people were smoking cigarettes. That was the thing, kids were taking off from school, running to the parks, and everyone knew that was the park to go smoke at. And police and other people knew how to rally up the kids and get them back and cite them, and then get them some sensation coursework or something to try to help them with the use. But this has taken over 20 years to reduce the prevent the use of youth utilizing tobacco products. Most recently, what I've seen is this surge of electronic device use. An electronic device could be a jewel, it could be whatever other aspect, and it's sold online, so there's, options to buying it online, but that is also sold in retail, brick and mortar, local businesses in the community. And to bring in ordinances, that's discussion, I think, that to be fair with my fellow council members, I would suggest that we have a clear workshops and discussion of these items. I think that the flavored tobacco electronic devices, from what I see in schools, it is being used, and it is not regulated by state, and school officials have a hard time keeping track of kids bringing them on campuses. But how do these ordinances minimize the access to underage use? And then the other part of it, that the FDA has not appropriately identified as electronic devices as a method to stop smoking. There's other medical terms that medical doctors or specialists will recommend about that. But I think that if I would be open to have some workshops and discussion to be able to bring everyone on board to say, perhaps there could be some room for ordinances. Let's look at what other cities are doing. Let's look at how we have a particular grant that our city police has been doing some shoulder tapping as well. And so there is some work that's being done on that. I think as a city, we're doing some of this work without even, I think, completely recognizing that we're helping minimize some of the use by our youth, hopefully. Underage use, I would say that. So I would propose and be supportive of a workshop if that was the direction we would want to move forward with.
Thanks. I think before I turn it over to and conclude my thoughts, a fair amount of folks are in favor. And there are a fair amount of folks, given by the volume of emails that hit my mailbox, that are concerned that it's going to impact their business. I don't think anybody discounts the fact that there are health risks involved with vaping and flavored tobacco. As a city, as Councilwoman Espandola commented on, it's difficult you don't want to get it, at least I personally do not want to get into a situation where we are, dictating what an adult has access to. But I'm deeply concerned, again, thank you for the information tonight, even more concerned about the effect these products are having on our youth and what that ends up turning into. You hear comments about government being transparent and got to involve all the stakeholders, but this is one that demands that kind of discussion. And I think I would concur with Councilwoman Espandola that some study sessions with all the stakeholders are in the room, so that we can hear and find the best way going forward that we can try to interfere with the opportunity for these devices and this substance to get in the hands of our youth. Thank you, Mr. Mayor.
All right, very well. Any comment from you two gentlemen? Okay, go ahead.
Thank you, Mr. Mayor.
Sure.
I would absolutely concur. This needs to have further discussion. When we look around, there's a lot of other municipalities that have had this discussion, and I think this council has already proven over the past year that we don't do things on our own. We're going to vet it out. We're going to have the discussions very open and transparent and get the community involved. I think we should look at not only protecting just our youth, because I do see the kids vaping. I see them still with cigarettes, and I just thank God that my kids don't do that. But at the same time, I'm curious to know, you mentioned vaping and your son's vaping. What is the secondhand smoke from that? Because I can't tell you how many times I've gone to walk into a bank or a restaurant or a store and someone walks out and takes a big puff and it's all over the air and you almost have to walk through it. What is that doing to myself? And, looking at where some rights begin and other rights end, it's one of those things we got to be very careful. But at the same time, is my health being put in jeopardy by someone else exercising their right that's violating my right? These are adult conversations that we need to have. And I would say let's look at municipalities that's taken the first step, which is banning the flavored tobacco and vaping. But let's also look at other measures that other communities have done to protect their communities and kids. And I mentioned to our city manager earlier, the city of Beverly Hills did something pretty astronomical roughly a year ago. And it had to do with vaping in public and everything. So not saying we're going there, but if we're going to have one part of the conversation, we really need to have the entire conversation. And I would like to see us kind of look at all, because our youth, they're not really the next generation for tomorrow. They're the leaders of today. They're going to be the ones that's going to be sitting in our seats in just a few years. They're the ones that's going to start up businesses. They're the workforce for the next 10 years, and we need them healthy, and we need them well educated. And so I would like for us to look at everything that involves the quality of life issues for our city, for all of our residents, not just the banning.
So explore all options.
Absolutely.
All right. One more shot? Good? All right. I think it's pretty clear. You message received, sir? All right. Looking forward to some additional information. We do want to hear all the sides, all options, so we can make a clear and reasonable decision on this. But we will move forward. That's the next step in the process. Thank you again to all of you who took the time out of your evening. Yes?
Excuse me. May I add to the request? I also would like to know, and I think you've made this presentation in the past, and maybe I just know it, but the number of vaping shops, I just did a very quick little Google search, and I found 9, and based on our population size, we have about 69,000 people. I'm kind of guessing. So the access of vape per person is about 8,000 people access per shop. So you're asked, so then you break down of that 69,000, we have about approximately 23,000 of our population are children. And so about a quarter of our community is made up of underage, kinder to 18-year-olds or what have you. And from my experience, I have heard the youngest age the most recent, last year, was a 4th grader, with a vaping. And so when I like data, because I think it's important that you bring us that clarity of the data. And if the business owners are going to bring us information, I like to see your data as well. Because the anecdotal, the emotional are important. They give us, some of that insights, but the clarity of the data of what is actually happening. So if you're telling, if you mentioned to me, ma'am, that you have about 12 employees and your business is on Colusa Highway, and so your revenue, whatever you're earning of that year, how much of your tax is coming back to the city? I would be interested to know those kinds of very specific information. And if you, that's what I'm looking at, holistic, big picture. Thank you.
All right. So once again, thank you to all of those folks who came out tonight and shared your points of view on the topic. We're definitely more to come, and we're looking forward to hearing from you with any additional information you might provide. So thank you very much. So if you want to step out, I'll take a 30-second break for you to do that.